Thank you for your patience, everyone. We'll be starting soon. All right. Good evening, everyone, and welcome to today's session. I'm Devana Gupta, Key Account Manager at Cardiula Health India. I present to you this webinar on pediatric cardiology, or in simpler terms, how does COVID affect a child's heart? I'll begin by introducing us. Cardiula Health India is a leading health tech company that's bringing a revolution in India. We provide global quality healthcare access to patients, even in the remotest parts of the country. With the current pandemic and lockdowns, virtual healthcare is on everyone's mind. The Cartula Health app is an end-to-end integrated healthcare platform. It provides tele-video consultations with doctors, COVID care, diagnostic tests from registered centers pan-India, and we also have tie-ups with the leading pharmacy partners. This app is freely downloadable from the Google Play Store, and we'd love for you to give it a try. Moving on to today's session, we bring to you an American board-certified pediatric cardiologist, Dr. Vikas Kohli. He's done his MD in pediatrics from PGI Chandigarh and fellowship from Miami, USA. He's the director at Delhi Child Heart Center. Thank you very much, Dr. Kohli, for joining us today. Without further ado, let's begin with the presentation. Over to you, Dr. Kohli. You're on mute. Please unmute yourself.
Sorry about that. Thank you, everyone. And thanks, Devina, for the introduction. I'm delighted to be amongst all of you. And I want to allay a lot of your anxieties, which you might be having related to children in your family or in family members, amongst family members, about how they're going to take the vaccination, what problems they could have, and also in addition, if some of them get COVID, what's going to happen. So let's get started right away. I'm sharing a PowerPoint presentation. So how does COVID affect a child's heart? This is what we are going to discuss. And children with heart disease, and heart disease happens to be the most common birth defect. 1 in 100 babies have a heart problem. Children with heart disease are getting COVID. COVID can also happen in normal children, and does that affect the heart or not? That's something we will explore. And the second segment of the talk is about COVID vaccines. And with COVID vaccine, suppose it's a child with heart disease who has to get a COVID vaccine. Is there any specific vaccine he has to get? Number one. Number two, a normal child without any heart problem gets a vaccine. Is there any potential of a side effect, especially related to the heart? And there is a lot of data related to that. Thankfully, not much data from our country, which is in the negative direction. So we all know about adults that, you know, heart patients, if there's an adult patient, 50-year-old or so, who's got a heart disease and then gets COVID, he is a high risk. And we also know that if they have high blood pressure, diabetes, or any other related major illness, major organ illness, they are high risk. So does that hold good in children also? If a child with a heart problem gets COVID, do underlying conditions, especially heart problem in a child, affect their outcome from COVID? So I'll tell you the story of not several children, but I've picked two particular children. 20-month-old child who's had a heart operation done several months back, gets COVID, had fever for 2 days, recovered completely. Parents were unwell for 5 days, they also recovered completely. No long-term issues, nothing. We checked the heart, no impact on the heart. Another girl, 14-year-old with 2 mitral valve surgeries, one with a mitral valve replacement, so she's got an artificial mitral valve, gets COVID, has fever for 5 days, oxygen levels were normal, did well, recovered completely, doing back to being with her friends, etc. So by and large, it seems like from these stories, at least 2 such patients, that children do well. But what is the data? Because data is everything. So one of the first countries to be affected was Italy. And this is the data from Italy, which came out the earliest. And what did they look at? They did a nationwide survey. Every child with heart disease was included in this. And they had 76, this was in 2020, last year, first wave, 76 children with heart disease who had COVID. And what did they find? The first pointer there is death. There was 0 deaths. This is very important. Only 1 patient had acute respiratory distress, breathing difficulty. 2 patients had cardiac complications. Majority of the rest did very well. There was no problem. This is 76 patients here. 70 of them did extremely well. No problem at all. So what is our experience? More than 50 patients with heart disease, I'm sorry, 5 is missing there. More than 50 patients with heart disease, either who have been treated by surgery beforehand or on treatment medically, that is requiring some medicines and not requiring surgery, got COVID. None required admission for deterioration of cardiac status or for respiratory status. None of those 50 patients. This is very, very important information that I'm giving you. So acute COVID in children with or without heart problem, the disease is not very severe. It's very rare to see a child who has acute COVID infection and will get admitted in an ICU with acute COVID pneumonia. Very rare still. And I've spoken to several pediatric ICUs and asked them whether this happened, and they recall only 1 or 2 children in the whole of last 1.5 years who might have come with something like this. So it's very rare. Now, what is the clinical cardiac involvement, if at all? Say a child has mild COVID and comes to us, what is the involvement that we are going to find most commonly? That their heart rate will be increased. Heart rate is the most common thing to get affected, but that gets affected with any fever, any infection. It is usually out of proportion to the degree of fever, but it does not require treatment. And technically, it is referred to as sinus tachycardia. That means normal rhythm, but fast heart rate. Few patients will get slow heart rate. And again, their heart rate would go down to 60 or something. That is not necessarily abnormal. All of us, our heart rates go down to 60 when we are sleeping. So unlike adults where slow heart rates go down to, in COVID, go down to 30 or 40 also, and rarely may require treatment, children, it goes to around 50, 60, does not require treatment and is much rarer than fast heart rate. Just a word about the fast heart rate. After COVID, I've seen a lot of patients come back a month, 2 months, 3 months later, especially teenagers, who say and complain that my heart rate is fast. And they've been checking the heart rate every day while walking, while eating, while sleeping, while bathing, while everything, they keep checking the heart rate. And what I found is the problem is not with the heart rate. I'm sorry about this. The problem is with them checking it continuously. And that's the problem. And the only thing they have to do is not check. Normally, all of us, our heart rates are varying, and they could go up to 120, 130 when we get angry, upset, or climbing stairs. So does the heart rate, heart function decrease in children with COVID infection? And does that happen often? No. It's very, very rare to see that happen during an acute COVID infection. In fact, some people have seen so rarely, they've questioned, should we be screening everybody? It is rare. Are we really missing it? So it is not common. And if we look very acutely, we may pick up few kids who have minor, but all the kids who had this also recovered completely and did well. Why does the heart muscle get infected or affected? That's because the virus goes inside the muscle and causes muscle weakness. or it can be certain chemicals that affect the heart muscle and causes swelling there, and that is how it happens, and it could affect the heart muscle. But children are still at a very, very low risk of getting moderate or severe disease as compared to adults. So the adult ICUs got packed, but the pediatric ICUs thankfully never got packed with children. Though there is one aspect of COVID which I'm going to come to a little later, where things can go wrong. So severe disease, COVID, cardiac involvement is only 2%. Only 2% of those with severe disease would get cardiac involvement. This is rare. So this is something one has to keep in mind. Now there is this aspect in children which I want to mention. Now this is not acute infection. Acute infection is you meet somebody, 5 days later you start having fever, that person had COVID, you get fever and you have acute COVID. That is acute COVID. During acute COVID, kids don't get affected badly. So what is this MISC? It is a multi-system inflammatory syndrome in children. Now, when does this happen? It happens 4 weeks after an acute infection of COVID in a child. Does the infection have to be severe? No. It can be mild. In fact, it can be so mild that the child did not even come to know, and it may even be asymptomatic infection, no fever happened in the child. But 4 weeks later, the child starts getting fever. And this is very, very important and totally different in children as compared to adults. So this refers to multi-system. That means multiple organs are now involved. I know it doesn't sound very good, but majority of children with this also do very well. It is characterized by a hyperimmune response in the body. So children have a much stronger immune system. And you know, everyone's been talking about how to boost your immunity. Well, our immune system is so strong that in children, actually very small percent of children, there will be an increased response, and that increased response will affect our own body. And that is what is MISC. That is why it takes 4 weeks to happen. And it is after an infection, the response of our own body to a swelling or an immune response within our body, which results and causes damage in multiple organs. This is MISC happening 4 to 6 weeks later. What do the children have? The children have persistent fever, weakness, rash, conjunctivitis, redness of eyes, prominent gastrointestinal symptoms, predominantly stomachache. So what kind of history are you looking at? That somebody in the family got COVID 4 weeks back. The child was isolated, did very well, did not have any symptoms, but 4 weeks after the family member got ill, the child starts having fever. And you say, hey, this is too late for COVID because it's 4 weeks, nobody's infectious. So why is the child getting fever now? This is MISC. There'll be swelling of lips, redness around the eyes, red strawberry tongue, red lips, swelling of hands and feet, especially the small joints. And it resembles a disease we call Kawasaki disease. It's called Kawasaki because it was first described in Japan by Dr. Kawasaki. Now, historically, what happened in the first wave was, which began in February 2020, that a doctor who's working in Italy, which is where it was first reported, noticed that he's seeing a huge number of Kawasaki disease patients in March of 2020. And the incidence was 5 times higher, exceeded of all the previous 5 years. The incidence was much, much higher. And it started the day COVID started in that area geographically. So he then labeled this as secondary to COVID-related post-COVID MISC. Now, this is not a disease we have classified ourselves as doctors. The Royal College of Pediatrics and Child Health of London, the Center for Disease Control and Prevention, Atlanta and USA, and World Health Organization, all three have come up with the criteria of diagnosis. There is a specific diagnosis criteria which has to be met. Only then a child with MISC is labeled. So the child doesn't have an acute COVID infection. This is 4 weeks after he was exposed, so his RT-PCR will be negative. but his COVID antibodies may be positive and will be positive. And majority of the family members would have been exposed. The child might be asymptomatic, and time from onset of infection in the family to MIS-C is 4 weeks approximately. And the fever will be pretty high. The child will be quite unwell, may have abdominal pain, may have redness of lips, conjunctivitis. This is MIS-C. And I don't mean to confuse you all or show you something complicated. Just follow this red line here. You all remember IL-6 during the first wave and second wave, interleukin-6. Well, this is that level in a mild disease. And in severe disease, MIS-C, this is IL-6. What happens to it and what causes the MIS-C? So just to give you a background of what is happening in our body when we have a hyperimmune response, especially in a child, 4 weeks later, it results in MIS-C. So we've seen about 40 children with MIS-C and persistent fever, elevated inflammatory markers, CRP, etc. 4 children of those had presented with shock also, that means low blood pressure, and 30 children fulfilled the criteria of Kawasaki disease. So multiple types of presentations, either with fever or with shock, very, very small number, or with Kawasaki disease. Kawasaki disease is again a condition which involves the heart. So this needs to be recognized. If it's recognized, it will be treated. If it's confused with, oh, is it dengue, is it typhoid, what is it? RT-PCR is negative. No, the doctor has to have it in his mind that he is dealing with MIS-C, and the treatment of MIS-C is admit the kid. If it's mild, you can treat it as outpatient. If it is moderate or fever is too high, child is unwell, needs IV fluids, you can admit the kid and give either what is called IVIG or steroids, and it resolves all the children. It will resolve heart function. Even in this second category, patients will come back to normal and they will do very well with it. So by and large, let's have a recap. Acute COVID, family member gets infection, kid also gets infection. If the kid has heart problem, he's still going to do very well. In the Italian study, none of the children with heart disease who had COVID died. In our experience, none of them required admission, did very well. So acute COVID is not a problem in our patients. So second, what can be a problem is MIS-C. Is heart involved in a normal child? Acute COVID, yes, only 2% of them will have heart involvement and good recovery of the heart if it's recognized. But by and large, it's rare. So overall, children do well. Now, COVID happened to everybody in the family. Child had very little affection or no affection of COVID. But 4 weeks later, the child starts getting fever, abdominal pain, diarrhea, redness of lips, conjunctivitis. He has MIS-C. He needs to be with a doctor who can diagnose and treat MIS-C. And majority of the pediatricians are aware of what is MIS-C, and it needs the treatment and the child recovers completely. Majority of the children with MIS-C will have a normal echo, but a small percent may have an abnormal echo. That means they may have some dysfunction. Now, children who have a previous unrelated heart problem, like a hole in the heart or heart surgery for some other reason, they will not have a more severe MIS-C or are not necessarily predisposed to MIS-C. So this is very important for us all to know. So this is the first segment of the talk where we talk about how does COVID affect a normal child, and then does it affect the heart or not? How does COVID affect a child with heart disease, and does it worsen his heart disease? No, it doesn't worsen. These 2 questions we've answered, and then we've talked about a post-COVID MIS-C syndrome, which we all need to be aware of, that if there's a child in the family who's exposed to COVID, 4 weeks later gets fever, better be with a pediatrician who can diagnose. Now let's get into the realm of vaccines, and we all have heard of Covaxin and Covishield and all the confusion, and we all wish for, oh, if we had Pfizer, if we had Moderna, you know, we would probably have done better in the second wave, and so many of us have lost family members. We don't really need to worry about that aspect, why we did not have Pfizer or Moderna, because even with Pfizer and Moderna, people are getting COVID Delta in US right now as we speak, and the hospitals and ICUs are getting full. So There may be something positive. Now, the way Covishield and Covaxin have been made is how all traditional vaccines for children have been made. Your DPT vaccine, your TB vaccine, all these vaccines have been made in a traditional manner, and that's how Covishield and Covaxin have been made. This is vastly different from how Pfizer and Moderna, which are not available in India, have been made. And this is a very, very important differentiation, that if I talk about Pfizer and Moderna, we are not seeing those problems in India, and they are not likely to happen in India. I would really like to underline that even before starting. The vaccines in India are Covishield and Covaxin. Trials have been conducted in children in India. No significant difference in adults and in children. Antibody levels are probably higher in children. No unusual side effects as compared to adults. No major side effects which we don't know of that may be happening in children. None of that recorded. So the conclusion preliminarily has been that vaccination, Covishield, Covaxin, are safe for children. These two vaccines are available in India. They will be out in the market soon, next month, hopefully. And vaccination in children in India is to start in September. And it will get started above 12 years first, because that's how it has been worldwide. The vaccination experience in USA in children has been widespread. Pfizer and Moderna are the only two vaccines, plus Johnson & Johnson, but these two majority, and they are not available in India. They're made with a different technology called mRNA technology, which we all have read about and have some idea about. They have been used in USA, and some specific side effects of only Pfizer and Moderna, not of Covishield or Covaxin, have been noted. I underline that, no side effect of Covaxin or Covishield. So what is that side effect of Pfizer and Moderna only? USA has vaccinated 177 million people till recently. In April 2021, they had received 1,000 reports, that is 1,000 patients who had inflammation of their heart and of the membrane outside the heart called pericardium. And this is a very, very unusual kind of swelling to happen from a vaccine. Luckily, this was very, very mild, and it is continuing to happen, and it is very mild. And it is so mild that in spite of it, they have not withdrawn the vaccine. The confirmed cases have occurred mostly and interestingly only in male, young adults, 15 to 30 years of age. After getting the second dose more so than after the first dose of the mRNA vaccine only, not of Covishield and Covaxin. And typically within several days, 3 to 5, 6 days after the second dose of vaccination was given, and mostly in men. If you remember, COVID also happens predominantly in men as compared to women, for a reason not known yet. So it is so mild that they require to give only pain medication to these children. Patients can usually return to their normal daily activities after their symptoms improve. They should speak with their doctor about return to exercise sports, which should be done after an echo clearance. If this side effect happens, which is only in USA, because these vaccines are not available in India, but we all need to be aware that this has happened in more than 1,000 people. CDC continues to recommend the use of vaccine for everyone 12 years of age or older, knowing very well that a very small percentage would have this side effect. Majority of those who had this side effect did not even require to be admitted to the hospital. Only 1 or 2 patients required to be admitted to the hospital, those who had swelling of the heart or swelling of the pericardium, and no death has been reported from this. This is something I highlight significantly. These effects are not seen with the vaccines in India. Young male adults under the age of 30 are mostly affected, mostly after the second dose. The problem resolves on its own, or maximum may require pain medication or something like paracetamol or ibugesic. So all said and done, vaccination with Covaxin and Covishield in India is anticipated to be very safe when it is released by the government of India for children above 12 years of age. We include in this all children with heart disease. That includes a significant group of patients, which includes those who have already been operated on, those who do not need operation and therefore are without operation but with a minor heart problem, those who have major heart surgery, including valve replacements, those who have irreversible heart damage where the heart function is less and are on medications for low heart function, and those who actually are having a condition called pulmonary hypertension. Even these people who are at very high risk of dying from COVID if they get a COVID pneumonia because their lungs are permanently affected. In fact, I have a patient with that who's even after that recovered from COVID. So I have positive stories to tell, more of COVID than of negative. So even those patients and all these patients need to take, and all inclusive, need to take the vaccine when it becomes available for children. The allergy remains the same as before, and as for everyone else, that's when they need to take the vaccine and not take the vaccine or take precaution for the vaccine. So last of all, their vaccination in children with heart disease is nothing special. It is the same as all other children, even with severe disease, no problem expected. All children need to take it as per the government guidelines. And I thank you for your attention and would welcome any questions that are there to be discussed.
Thank you, Dr. Kohli. That was a wonderful presentation. We all now have a fair idea of how COVID affects a child's heart and how vaccination can help. I'm sure our audience has a few questions, which now leads us to our question answer session. Participants are welcome to type their questions in the chat box, and Dr. Vikas will be taking them up one by one. Please go ahead.
Sir, good evening, sir.
Yeah.
Sir, can we unmute and ask?
I don't know, Devina, can they unmute and ask?
Okay, sure. Please
I'm
go
fine
ahead.
with that. I'm fine with that.
Okay.
Sir, I am Dr. Abdul Khalif, sir.
Yeah, tell me, please.
Yeah, sir, I have done few parasternal short axis views to look for coronary artery dilatation in few COVID recovered patients who had features of MISC, sir.
Right.
A few literature I have gone through, they say that the diameter of the coronary artery should be more than 3 standard deviation, and some Z score is also given. Can you give some reference with regard to this Z scores? Where can we get those information? And is there any specific number above we should be very careful that it is dilated or something?
There is an app and there is a website. I have already put it in the chat box, parameters.com. Dr. Abdul, just go to that website. You will get everything normal for children of any age from 1 day of life till 18 years of age. Everything you will get, all heart parameters, including coronary size. So this is a technical person who does echo, not a doctor who's made this for the convenience of all doctors. And I think he's done a tremendous job, and you can help yourself to information in this world of free information. This is a very valuable piece of information which you can use for all your patients.
Yes, sir. Yes, sir. Thank you, sir.
Sure, my pleasure.
Thank you, doctor. Any other questions? Participants, we'd prefer if you could just type them in the chat box. Otherwise, audio is fine.
So while a question may be being typed, I'd like to say that, by and large, I've seen about 70 kids with COVID and heart disease. None of them required it to be admitted. And I've seen about 50 kids with MISC. And that is when they were RT-PCR negative and getting a problem. These are a set of different 50 patients out of those 70. So only about 2 or 3 of them had a significant heart involvement. Maximum 5 patients, 2-3 had coronary involvement, and 3-4 patients had heart function which was decreased. In fact, So I think, COVID in children and children with heart disease, I wouldn't say is a safe disease to get, but I would say that it is a condition which does not become life-threatening, even they have a heart problem, even if they have an uncorrected, very major heart disease. Another question is, when can we expect vaccination of children below the age of 12 years? I think by October or November it would be coming. I think the delay is not because of data. The delay is because of availability of vaccines in India, basically all over. So I'd like to say that the moment we have enough vaccine available, it will be available to children under 12 also, because our vaccine is very safe. Our vaccine does not have the side effects of Pfizer and Moderna, which we've talked about. And this is Mr. Rajat Bakshi who was asking this question. I hope that answers it for him. Shreya Sharma has a question, sir. Any exercise or any herbs help in preventing heart disease in kids? So I have sat and talked with specialists of variety of medical areas, including, I practice allopathy, including homeopathy, and you name it, every other specialty. And these are academicians I've spoken to. And they have said that they don't have anything which prevents heart problem or treats heart problem in terms of herbs. So your question is also, any exercise may help prevent heart disease in kids. So heart disease in kids are of two types, congenital and acquired. Congenital happen at the time of birth and is unrelated to mother. The mother is not the cause of congenital heart disease that happens in a baby in any way. It happens as an accident of nature, very unfortunately. So it is not preventable. 1 out of 100 babies will get it. We don't know if science has really researched a lot, but not found anything which can prevent it. Exercise definitely doesn't. But when we talk about acquired heart disease, there are several things one can look at, and obviously lifestyle changes to prevent heart problem in children, like obesity, hypertension, etc., diabetes. All these ultimately lead to heart disease, and all of it actually starts in teenage years. And in India, about 45 to 55% of all teenagers are already obese in urban areas. So we are talking about a huge number of patients getting into heart problem, and the ideal thing for them to get over with and to improve their physical fitness is to follow what we call DASH diet. Exercise 30 minutes a day. Exercise is defined as, at the end of a session, you should be sweating and not just walking. If you're not sweating at the end of 30 minutes of walk, that's not counted as exercise. This is the American Heart Association classification or definition of exercise. So regular exercise, healthy diet, and I would just like to say that healthy diet includes more of vegetables, more of fiber, less of carbohydrates in our diet. So Dr. Abdul Khalif has another question, next question. I hope that answers your question, Shreya Sharma. Dr. Abdul Khalif has a question: mitral regurgitation, pericardial effusion, LV dilatation, perivascular cuffing of coronary arteries. Sir, anything else to look for in 2D echo in MISC? No, and I wouldn't give him emphasis on perivascular cuffing of coronary arteries. Thrombosis is obviously very, very rare. I have seen one patient with pericardial tamponade presenting in MISC. So that's something to keep in mind, which has not been reported otherwise. Gautam is asking how we can keep away small child from getting COVID. There are only 3 things defined till date to prevent COVID. So sanitizer, mask, and social distancing. Those are the only things that you know of. So prevent that in your child. Don't allow people to get in. Don't expose yourself to others. You would come next to your child. That's the way to go about it, Gautam. Sai Sujana has a question. Sir, a child admitted with me developed MISC with pulmonary fibrosis and dilated coronary arteries. So pulmonary fibrosis is extremely rare in children. It may be a case report. It is so very uncommon. Dilated coronary arteries are something we look for. Majority of them will improve. In my experience, they do improve once the treatment has been given. For pulmonary fibrosis, which is beyond my scope and potential, you would need to give antifibrotics and follow the child up, and hopefully he would get over with it. You've also asked one more question: what is the prognosis and medications that we should give other than IVIG, methylpred, and aspirin? So other than IVIG, methylpred, aspirin, these are the three main medications. Very small number of patients will require ECMO if their heart is failing and they are in total shock. And I have known of a few patients in India who have received ECMO. Antifibrotics used in children. So anticoagulants have been used, but antifibrotics in children would be beyond my scope. I'm a cardiologist, not a pulmonologist. Dr. Abdul Khalif has another question: aspirin in MISC with dilated coronaries or coronary thrombus, 3 to 5 milligram maximum 81, how many days and how frequently follow-up echo? So this is a good question. It's very well defined by the international committees that give it for 4 weeks if there is no coronary involvement. If you have coronary involvement, give it for 6 weeks. And if the dilation persists beyond 6 weeks, then continue it till there is dilation, the low-dose aspirin. And the echo is at discharge from hospital, at 6 weeks after discharge, 3 months, 6 months, 9 months, and 12 months. 4 echoes at 3, 6, 9, and 12, and 2 weeks after discharge. That's how it's very well defined in the consensus statements which are available on the net. So 4 echocardiograms need to be done. All patients with severe MISC need to have an echo done. All patients with severe MISC who are admitted or treated need to get echocardiography done. That's underlined. That's international consensus, not my viewpoint.
So we also have another question from Sai Sujana Chiduri, which is, what is the prognosis and medications that we could give other than IVIG, methylpred, and aspirin? And is there any antifibrotics used in children?
Right. So the prognosis is very good. In fact, very bad MISC with shock presenting in the ICU has dramatic improvement, and they recover. They may have a longer stay in the hospital. Milder MISCs improve very rapidly. Moderate MISCs who have some other degree of involvement do very well subsequently also. All such patients are on follow-up. I haven't seen pulmonary fibrosis, and that also is beyond my domain. I've heard of 2 kids in the country. One, unfortunately, was a doctor's child who needed ECMO for MISC. But apart from IVIG and methylpred, we don't need to use anything else. Aspirin is to follow the IVIG, and for outpatient use, I think this is basically it. People have added antibiotics to it and other things, but that's just incidental. There are studies which clearly say that you can use only methylpred and not IVIG to reduce the cost, and the outcomes are the same. Children do very well. IVIG is a drug which is extremely expensive. Every 5 grams of it costs 15,000 rupees at least. So 2.5 kg child would require 5 grams of medicine. So 2 grams per kg is given. A 30 kilo child would require 60 grams, and it would go into lakhs of medicine. But there are authentic studies which talk about use of only methylpred without use of IVIG and have similar outcomes. So one can reduce cost when dealing with poor patients in low medium income countries like ours.
Thank you, Doctor.
Sure, thank you. Dr. Abdul Khalif has another question. Sir, have you seen MISC without coronary involvement? Majority of the MISC are without coronary involvement. If no coronary involvement, then how many echoes? I would just do one more good follow-up echo on these children. The recommendation is the same, that you need to do multiple echoes if you really diagnose MISC. Priyanka Sachdeva has a question. It has been said that vaccines for children will be available from next month. How safe is it? Very safe in India with Covaxin and Covishield. Would you recommend it for children who have undergone VSD corrective surgery? Absolutely. They are as normal as every other child, and they should get the vaccine, and their lifestyle should be no different from anyone else. So I hope that answers your question, Priyanka. That's a very good question. That's an anxiety of a lot of parents who call me, and when they meet me, this is one question I get asked every single patient every single day. Pleasure is mine. Thanks. So I think overall children are pretty safe from COVID, from very severe form of COVID. They are relatively safe. Vaccines are helpful for children. They will definitely prevent the severity of disease, and MISC is a major problem in children rather than acute COVID, and that's what we need to look at.
Thank you, Doctor. I hope everyone's questions are answered. And to conclude the session, I'd firstly like to thank Dr. Vikas Kohli for speaking with us today at this insightful session. I'm also grateful. Okay, excuse me. There's another last question. That's the last question we'll take. Sir, third dose of vaccine ought to be inactivated, Covaxin, among those who have taken two vector-based vaccines, Covishield. Is it true?
So I don't know the answer to this question. There is a lot of contemplation about a third dose of vaccine amongst doctors. There is some data which is coming out, and I think they are recommending it in US because they are facing Delta about 6 to 9 months after the majority people started receiving vaccination. So they want to give a booster. In our country, majority people are yet to receive the vaccine, and Delta has already happened. So by the time third wave, which is a very slow, insidious wave, which is ongoing or which may happen over a prolonged period of time, happens, majority would get vaccinated during that. And I think a third dose 6 months after the last dose would be a booster. I don't know. There is no recommendation yet whether one would need to give it with an inactivated one or with a vector-based one.
Right. Thank you so much, Doctor. As I was saying, I'm grateful to Dr. Kohli for speaking with us. I'm also grateful for everyone who's joined in, and to Cartula Health India for organizing this webinar. We will continue this series with another relevant healthcare topic discussed by an industry expert like today. Until next time, friends, stay healthy, stay safe. Thank you.
Thank you. The pleasure is mine.